It's still setting up. Good afternoon and welcome to Ask an Advocate, brought to you by the Pennsylvania Coalition Against Domestic Violence. I'm your host for today, Lauren Duff, Communications Manager at PCADV. And today we'll be talking with Maria Williams, the Housing Manager at PCADV, all about housing in relation to domestic violence services. Maria, thank you so much for joining us today.
Of course, thanks for having me.
Awesome. So we're going to hop right into our topic for today. And I just wanted to start off with asking you to tell us a little bit about the connection between homelessness and domestic violence.
Sure. So homelessness and domestic violence isn't something that had been talked about as an intersection prior to probably like the last 10 or so years. And what really came about was a number of some federal legislation that allowed domestic violence survivors to get some specific assistance through the homelessness system. And at that point, the data really came forward that showed that there is a significant intersection between families that are homeless and survivors of domestic violence. So in the real world, what that looks like is that about 80% of families who have experienced homelessness cite that they've experienced domestic violence also at some point, which is a staggering number. And then almost the more significant number for our work is that 50% of families that are currently homeless say that domestic violence was the direct cause of that homelessness. So oftentimes survivors, if they are wanting to leave an abusive situation, they don't have anywhere to go. And that's something that we know. And the domestic violence shelters have often been the answer to that, but there is significant stigma around DV shelters. And when a survivor enters domestic violence shelter, they are considered homeless at that point. And while that's a great option for survivors that need that safety response, there needs to be a variety of other options. And that's something that we're really working on hard in Pennsylvania to make sure that there are those other options. I think that oftentimes, there's this idea of why doesn't the survivor just leave and why can't they just figure this out? And most of the time survivors don't have the ability to go out and rent another apartment or to buy another home, much less if there is domestic violence happening in their home and they want to get away from an abusive partner. And oftentimes survivors have sort of worn out every connection that they have with family. Abusive partners do that intentionally to isolate a survivor. So a survivor is trying to move through one of the most difficult transitions of their life, leaving an abusive partner, with almost no resources most of the time, because we also know that abusive partners use money as a method of control and oftentimes don't allow survivors to have access to money, or you use money in other ways that keep the survivor at need to ask the abusive partner for money. So there's no way to leave in a way that makes sense. Also, oftentimes kids are involved, and it's really, really challenging to make a plan. What we've found in the field is that if a survivor is given the opportunity to move into permanent housing, which means move into an apartment with a lease in their name, a home with a lease in their name, they are far more likely to leave, and because they have the security that they wouldn't have otherwise. And that sort of mental and emotional security for a family that's experiencing domestic violence is the greatest way to create safety. So the intersection of domestic violence and homelessness is significant, and it's like any intersectionality, that we can't talk about domestic violence without also talking about homelessness, without also talking about race and poverty, and all of these other things that play into the idea that survivors are kept from accessing resources in the way that they need to live the most healthy and safe lives. So what we're doing at PCADV is helping our member program set that up. and that looks different in every community, and that response to domestic violence homelessness needs to look different in every community. And that's part of the reason that PCADV is sort of functioning as a convener for our member programs to figure out what's going to work best, what they need, to make sure that they can make sure that a survivor never has to choose between staying in an abusive home and sleeping on the street. So the intersection is significant.
Great. And you kind of leading into this with talking about how housing is so important in that feeling of safety and victims actually being able to leave a situation. Can you tell us a little bit about the domestic violence housing first philosophy and how PCADV works with that?
Sure. So I'm going to share my screen, which is always a challenge. Okay, Lauren, can you see that? There we go. I'm hoping you're seeing a slide. So the domestic violence housing first philosophy is the idea that, just as we were talking about, if an organization can help a survivor move into permanent housing without having to first become homeless, the likelihood that that survivor is going to stay safe is far greater. We also know that survivors have a million things that they have to deal with on a daily basis, and that it's far easier for them to deal with those things, like making sure their kids get to school and making sure that they're dealing with all of the legal issues that often come hand in hand with domestic violence, if they have a safe place to stay that they know is permanent for themselves and their family and safe and stable. So DV Housing First movement came from the idea that we needed to provide another option for survivors, that there needed to be a different idea than just the traditional shelter housing. And there's never enough domestic violence shelter space at any rate, particularly in high urban areas. Our programs in Philadelphia and Pittsburgh and other urban areas in Pennsylvania often can't serve everyone that they would like to when they're getting calls for domestic violence shelter. So if there are things that can be offered instead of domestic violence shelter, oftentimes that will solve a survivor's issue around where they're going to go next. So DV Housing First really addresses that concern. It also really reduces the rate that a survivor would become homeless again. So oftentimes a survivor would go into shelter and then would have nowhere to go after their shelter time ended. And so moving someone into safe and secure housing first keeps that from being a concern. So domestic violence housing first was developed sort of on the West Coast. There's a number of different programs that did a number of different things with it, which is really exciting. And what we've done here in Pennsylvania is taken this information that we've found from other states and we're applying it here. So the main tenets of domestic violence housing first in that idea are survivor-driven trauma-informed mobile advocacy, community engagement, and flexible financial assistance. So PCADV has taken it on that we want to help all of our member programs identify what these three spokes of this wheel essentially look like in their community. So survivor-driven trauma-informed mobile advocacy means that the survivor is in control of what's going on, that the advocate is working as, or the supportive counselor is working as a person who is providing them with options, but the survivor is in charge of their life because we know that survivors are experts in their own lives, just like anyone else. And oftentimes when survivors come into the domestic violence system, that can go away. And we want to make sure, because systems oftentimes work against people that need it the most, that the DV system is not doing that. And so when we say survivor driven, that's what we mean. And then trauma informed is a buzzword, but really what it means is that we don't want to re-traumatize survivors when they are engaging with domestic violence services. And so doing everything we can to normalize what's going on for them and help them in the ways they're identifying they need. And then the other piece of this is going to meet the survivor where they are. That can be very literally in their own home, if that's identified as safe by both the survivor and the advocate, or it can be meeting out at a park, which is wonderful for social distancing needs, or getting a cup of coffee somewhere and sitting and talking like you're building community rather than you're providing services, which is a really key component to this. The second piece of this is community engagement. And what that means is working with your community to make sure there's affordable housing available. Affordable housing is one of the biggest concerns that's cited across Pennsylvania, really across the United States, as to what keeps people out of housing. And so we want to make sure that our member programs have the ability to engage with funders in their community, to engage with housing providers in their community, whether that's their public housing authority or private landlords, to make sure that survivors have a place to go. That's going to look really different in each community. Each community has different needs around that, but that's an essential piece of it. The other part of that is looking at what community supports really help someone continue to stay housed. So that could be a great connection with a food bank, or it could be a local church that wants to provide household items, and that's how they're looking at doing their service work in the community. And so making sure those partnerships are in place. So the entire burden of keeping a survivor housed doesn't fall either on the survivor or on the domestic violence program. But the homelessness really is, and prevention of homelessness really is a community response, in the same way that prevention of domestic violence is a community response. And then the third piece of this is flexible financial assistance. And what that means is that a domestic violence program can give a survivor money to make sure that they're able to stay housed. And that seems really straightforward. Unfortunately, it is not, because there's a lot of need. And this is sort of a new concept in domestic violence work. The idea of flexible financial assistance came from the idea that government funding that usually supports people being housed is nowhere near flexible enough to meet somebody's needs. And so what we want to do in the Housing First philosophy is make sure that our member programs have money that they can spend to do things like buy a survivor new tires for their car so they can continue to go to work, so they can continue to pay their rent. So housing stability is just baked into the nature of this, and making sure that all of these pieces work together to keep a survivor safe and stable in their housing.
Great. Are there any interesting initiatives around domestic violence housing first happening in Pennsylvania right now, or anything on the horizon?
Yeah, so the member programs in Pennsylvania are working really, really hard to make sure that they have options for survivors in their community, which is really exciting. So over the past couple of years, the idea of rapid rehousing has really spread throughout Pennsylvania. And rapid rehousing is an initiative that is provided by HUD at the federal level. So the Department of Housing and Urban Development that funds not all, but the great majority of housing assistance across the country. The initiative is called Rapid Rehousing, or the intervention, excuse me, is called Rapid Rehousing. And what that means is that it's short term, and that can mean a lot of different things. Housing assistance, rental assistance specifically, that's provided to a family in need that's eligible for that service. The eligibility piece of this is crazy, and so we're not going to get into it right now. But if a survivor is eligible for that, they can receive it. The great thing is that HUD in the past couple of years, due to the advocacy on part by many of our national partners that work at the intersection of domestic violence and housing, have advocated for what was called the domestic violence bonus. And so what that meant is there was domestic violence housing money set aside specifically for our communities, which is really exciting. So nationally, that was applied for. Pennsylvania, because of the incredible work that's been done here for years, did really well and brought in quite a bit of money statewide to be able to provide this intervention, which is great. Because when domestic violence service providers provide rapid rehousing, it's far more flexible and in tune with domestic violence housing first philosophy, where if rapid rehousing was provided by a mainstream homelessness organization, so often the community action agency within your community, it won't be as flexible as what the domestic violence program can do. And that's for a variety of reasons. I think that all housing should be as flexible as possible because we want everybody to stay safe and housed. But if we want to make sure that domestic violence survivors are specifically catered to in this way, because we know that it works and we know that it keeps them housed. And that's the most important piece of this. So there's a great rapid rehousing initiative happening across the state. It's happening in both rural and urban areas. And programs are really working hard to make sure that that intervention is really tuned to what survivors need, which is great. The other thing that's happening that's really exciting is that in Pennsylvania, and this is actually something that's unique to Pennsylvania, is that we're working to pair the flexible funds that I was talking about before in the car example, the tire example, to pair those flexible funds with rapid rehousing. So survivors is really able to get their entire housing need addressed financially through the Domestic Violence Service Organization, which is really exciting. So through a partnership with the National Alliance for Safe Housing and Regional Legal Housing Services out of Philadelphia, we are offering flexible funding and landlord engagement assistance to some programs in the Southwest area of the state to pilot what we're calling the Safe Housing Initiative, which is really exciting to find out what the power really is of pairing flexible funds with rapid rehousing in both urban, so in Pittsburgh, and rural places like Montgomery, or sorry, places like the Southwest counties that are far more rural than the areas outside of Pittsburgh, even in Westmoreland County and places like that, to make sure that we really know what survivors need across the state, because we know that Pennsylvania has incredibly urban areas and incredibly rural. We want to make sure that we're looking at what works best for survivors, regardless of their demographic. And so that's really exciting. And then in the eastern part of the state, along with rapid rehousing money, there has been a program called Home for Good, which is a state-funded program that provides some of that flexible assistance also. And they've paired that with rapid rehousing there and are seeing some really great results. It has been really challenging though, because as that money came in, we experienced the shutdown with COVID. And I think that it didn't allow the organizations that are spending that money to really do the things they wanted to do with it, which is unfortunate. But nonetheless, did play some really specific role within the COVID response, which I think was exciting. So when you have flexible funds available, it's far easier to keep survivors housed. And having that paired with rapid rehousing really allows for a variety of response rather than a narrow one, which is great and happening in all parts of the state. We want to look at how that goes and look at how that needs to be tweaked, and then support both the member programs and applying for funds on their own to do this, and then also looking at PCADV as a pass-through funder for those member programs to make sure that they don't have the burden of administration of all of these funds, because there is quite a bit of admin that goes along with it. And we can help make sure they're getting the resources they need regardless of the size of organization. So it's exciting, and we're going to have great data and great research done by Michigan State University and Dr. Chris Sullivan to evaluate the project in the Southwest to then replicate it across the state.
Wonderful. That's really exciting to hear about some of the innovative ways that programs and PCADV and NASH are approaching housing and keeping survivors safe in a way that works for them, especially with the the broad variety of communities that we have across the state. So we look forward to hearing more about how that goes, and hopefully how that can be expanded to more communities across Pennsylvania.
Absolutely. I think that it's great too, because Pennsylvania is really being looked at as sort of a testing ground to see what can happen, because the work that's being done here by member programs is so innovative. And that really lends well then to be able to provide unique response.
Yeah, absolutely. And you brought up COVID-19 and giving everything that's been going on in the world these past many months now. Um, Tell us a little bit about how programs adapted their housing services once the pandemic hit.
Yeah. I think that it was certainly unlike anything that we had experienced before. I heard from some programs in Texas that preparing for COVID, and preparing is loosely stated, obviously, was very much like preparing for a hurricane. And the wild thing about this now is that it's a hurricane that's gone on for 7 months. So I think that COVID really affected different parts of Pennsylvania differently, and still is. And so there are member programs in the north part of the state, the very north part of the state, that didn't even change what they were doing, that they just kept providing services in the way that their community needed, which I think is so phenomenal and really commendable. And then there were member programs in places like Montgomery County and Delaware County and Pittsburgh, where everything had to shut down because the shutdown happened statewide so quickly, and the urban areas were hit the hardest. So each program had a different response, which I think is really incredible. And one of the things that we did, again, at PCADV is function as a convener for the programs to come together to talk about what they needed. And that's looked like everything from topic specific calls with executive directors to a call that myself and a couple of our other colleagues run every other week with the shelter managers, because it's been the shelters that have really been having to pivot the most. So what they ended up doing was really relying on local hotels. And this is something that's done in other parts of the country too, that hotel is the response to emergency shelter rather than having a building, which has its pluses and minuses, but is definitely something that happens in other places in the country, and happens in two specific communities here in Altoona and in Scranton. And they have pioneered this work really, and we're able to provide ideas about how to best provide hotel assistance within the context of emergency shelter, which is exciting and different, and really allowed programs, I think, to expand and brainstorm in ways they hadn't before, and really begin to rely on each other too, which is essential. So that pivot to hotel was a lot, and it was expensive because hotel rooms are expensive. But it did allow for social distancing, and it allowed for survivors to get their needs met in the way that was so essential, particularly during the first part of the COVID shutdown. The other thing that happened with that then, and we talked about this in the DV Housing First model, is that mobile advocacy really became an essential service. And so rather than expecting a survivor to come to an office, advocates began meeting survivors in the community, or most appropriately, meeting survivors over technology. And so we've been doing a lot of work making sure that that our member programs have both access to technology, and then also access to platforms that are safe and secure, to make sure that they can have meetings over something more than FaceTime, even though I know that that's what a lot of folks do. And I think that, like, if that's what needs to happen and the survivor understands the risk, then that's something that should be done. But there are lots of platforms that you can engage in that provide safety and security, that, just general things like FaceTime and Zoom don't. And so our member programs have been providing direct services over technology and support groups, and doing all of this really innovative work. And the thing that a couple programs in particular have reported is that this has allowed so many more survivors to engage. There isn't the barrier of transportation, which is really great. And there isn't any sort of expectation that a person has to appear in a certain way or be a certain way, that you're able to just log on from your home and get the support that you need, which I think is really exciting. And this is something that I know that many member programs are going to continue doing, which is great. Many member programs are also going to continue using hotel, both because if their shelter is open again, it's opened with social distancing measures in place. And so they're not able to house as many folks in emergency shelters they did prior. And so they'll be using hotel to do that. I was and still am so wildly impressed with the way that the response was handled by the domestic violence programs across Pennsylvania. You never expect to have to deal with something like that and have to overcome something like that, where you know that you need to be providing services to folks that need it the most. But DV programs aren't supported in the same way that emergency workers across the state or across the nation were. It really is sort of an unsung profession, and the way that the DV advocates across Pennsylvania showed up over and over and over again and risked getting sick themselves, risked time with their own families, I think is really incredible and commendable work. And I think that looking at what has come out of it as continuing as best practice for survivors is really exciting.
That's wonderful. And, a big thank you, not only to you for joining us today, Maria, but to echo what you said, to all of the programs and all of the staff at all of the programs across Pennsylvania that really didn't miss a beat to continue being there for survivors during everything that's happened since COVID-19 came into our lives. You're right, it's been absolutely impressive, and they never stopped doing what they were doing to help survivors, and we appreciate that, and appreciate you sharing their experiences with us today. Is there anything else that you would like to add today about housing, or what we have coming up in the future with that? Anything at all?
I don't think so. I think that we covered most of it today, and I think that the housing work that's happening across Pennsylvania is really going to set the standard for what happens across the country. And I think that that is speaks to years and years and years of work done by programs at the local level to really build up what can be done now when money is available and resources are available and organization is available. And so it's really exciting. I can't wait to see where we go and how we're really able to move the needle on the needs of survivors that are experiencing homelessness and that need a place to go that's safe and stable for themselves and their families.
That's wonderful. And we look forward to checking back in with you in the future to see how the pilot program has gone, and what the state of housing and domestic violence is, as we move forward in the awesome work that the programs are doing and that PCADV is participating in to help make sure that all survivors have safe and secure housing. So
Great.
Thank you, Maria, so much for joining us today. We really appreciate it.
Have a great day.
You too.
Bye.
Bye, everybody.